afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Today, we are announcing 7 new cases of COVID-19, including a school-based case that was identified today at Shannon Park Elementary in the Central Zone. That school will be closed for the rest of the week while Public Health does contact tracing. And Dr. Strang will have more to say on the remaining cases of COVID. But I want to focus on some good news, and we could all use some good news. On December 15th, 1 week from today, we're expecting our first doses of COVID-19 vaccines to arrive in our province. The first shipment will include 1,950 doses, which will be administered within days, pending, of course, Health Canada's approval. We will start with frontline healthcare workers who are at greatest risk of coming in contact with COVID. Those who work in our COVID care unit, intensive care, and of course long-term care. Over the next several months, we will receive weekly shipments. After frontline healthcare workers, we will then move to long-term care homes for residents. And we will be rolling the vaccine program out across our province over a period of months. Eventually, the vaccine will be made available to everyone, but we have to start first with those who are most at risk and most vulnerable. We've created a SWAT team inside of government to help with logistics, and I want to thank the Canadian military for joining our ranks. They have logistics expertise and, of course, a passion to help all Canadians, and we're grateful that they're here to help us. This will not only be a test not only of logistics, but of patience. We want everyone to be vaccinated as quickly as possible, but we must accept that the rollout will be gradual and based on supply. And we all want to make sure that the most vulnerable citizens in our province are the first to be vaccinated and those who care for them. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And just to repeat a bit, but we are reporting 7 new cases of COVID-19 in the province. 4 of them are in Central Zone. 2 of those are connected to previous cases. 1 is under investigation, and 1 is connected to Shannon Park Elementary in Dartmouth. And that's an active case just earlier today, and that's under active investigation, working with the school and the education system. Outside of Central Zone, one of today's cases is in the Northern Health Zone, and that's connected to out-of-province travel. We have 2 new cases in the Western Health Zone, and they're connected to previous cases, and the original case was travel-related. But both of these cases are associated as workers in a large poultry plant in the Annapolis Valley. The company has let its employees know about the temporary shutdown that's at this plant that starts tomorrow, and Public Health will be working with the plant to arrange testing for employees starting tomorrow, and that there's about 450 employees at that plant. So that's certainly, and people I'm sure may hear about that, but we wanted folks to know that we're well aware of this, and I believe we're on top of this, have a very good protocol rolling out in good cooperation with the employer at that plant. So we now have 78 active cases of COVID-19 in Nova Scotia. No, unfortunately, is in hospital. Since October 1st, which is our beginning of the second wave, we've had 294 cases in total, and 216 of those can now be considered resolved. What we're seeing right now in all our key indicators is encouraging. The number of new cases is going down and starting to level out. We've had 4 consecutive days where our number of cases is in single digits. The number of active cases is decreasing back down to double digits and is also slowly going down every day. And the number of close contacts per case has come down significantly over the last week. And most of our new cases are connected to previously known cases or to travel outside Atlantic Canada, which is a good sign. It's getting back to more of the pattern that we saw before the beginning of the second wave. So all of this is encouraging, but we need to make sure that these trends continue over the next week and beyond. I know everyone is watching the numbers with cautious optimism and wondering when and if the restrictions in the affected areas of HRM and Hants County are going to lift. These restrictions will stay in place up to and including Wednesday, December 16th. Where we go from there, my team and I are watching the key indicators closely. We'll be having discussions with the Premier in the days ahead. We do understand that restrictions like these have impacts on people's lives, their livelihoods, and their families. But the restrictions we have in place are necessary to help control the spread of COVID right here in Halifax and prevent it from spreading to other parts of the province, and also to prevent it from spreading into older populations where there's a much greater risk of severe disease. And so far it does seem to be working. On the compliance side, I heard yesterday from my colleagues at the Department of Labor, who are doing a lot of the compliance visits to various businesses. They have been out in full force both in the central zone and in other parts of the province, especially focusing on the retail environment. And what I'm hearing from them is that the compliance has been exceptional. They've done more than 70 spot checks in the Halifax area and have reported no issues at various retail establishments. Their focus has been on bigger box stores, on malls especially. So the restrictions we have in place are working, and it's really encouraging to have reports like this to hear how everybody is even as challenging as it may be to their business, are committed to doing the right thing, being part of our collective effort to bring COVID back under control. So I want to thank everybody, including these businesses, for continuing to do all the things that we're asking you to do, for being part of this effort, no matter how challenging it may be. As we've said several times here in the last couple of weeks, doing this together is what allows us to get out of this as quickly as possible. But it does mean that over the next few weeks, things are going to have to continue to be tight in terms of COVID restrictions. It means that our holiday season is going to be different, and I'll come back to that in a few minutes. But right now, I want to share some updates. As the Premier has kind of pointed to, there's some exciting updates and where we're at on the vaccine front. We now have certainty that we will be receiving our first doses of the Pfizer COVID-19 vaccine, 1,950 doses on December 15th. As I've mentioned before, that we'll be following the guidance from the National Advisory Committee on Immunization, who have produced guidance for all provinces and territories on priority groups who should get the vaccine first. So operating within that guidance, we'll be using these first almost 2,000 doses to immunize frontline acute care healthcare workers in the central zone who are most directly involved in the COVID response. So those are people who work with patients in intensive care units and emergency rooms, people who work in the COVID units in our hospitals, and also starting to get staff who are in the new long-term care regional care units in the central zone as well. The Pfizer vaccine has to be kept at -70 degrees and has very specific handling requirements. And for this very first shipment of doses, the manufacturer has specified that we have to immunize people at a site very close to where the product is physically stored. We are not able to transport the vaccine beyond that. So that is an important consideration that we have to accommodate as to who are the almost 2,000 people who are going to be the first ones to get vaccinated here in the province. But also we need to protect and preserve our frontline healthcare workers so they are around and kept safe, so they're able to treat not only people with COVID, but everyone else as well. We are then expecting to get weekly allotments after December 15th and throughout the first quarter of 2021. We're still waiting for final confirmation on that, but our planning is based on that expectation. Our decisions on who will get the vaccine and in what order will continue to be based on the guidance from the National Advisory Committee on Immunization. So along with the priority healthcare workers, those who are directly involved in the COVID response and COVID treatment, we will start to immunize long-term care residents as soon as the storage and handling requirements of the vaccine products allow that. and along with them, other long-term care staff who may not be directly working at one of the COVID treatment units. And then we'll be able to start moving into the community. And following the NACI guidance, it will be starting with people who are 80 years of age and over, and then moving down by 5-year increments, people who are 75 and up, people who are 70 and up. It'll likely be the spring of 2021 before we can expand beyond all these groups into other healthcare workers and other essential workers. And it'll most likely be the summer of 2021 before we can start offering vaccine to the broader community. So we are expecting to get 150,000 total doses of vaccine between now and the end of March of 2021. That means we can immunize 75,000 people. The vaccines require 2 doses, about a month apart. And so that, as I said, the priority groups that I mentioned will be the ones who are within that first 75,000 people to get immunized. And so we're probably looking at the fall of 2021 before we're actually finished with the full COVID immunization program, and every Nova Scotian has had an opportunity to get a COVID vaccine. So it's important to understand the time frame of this, and the Premier mentioned patience. It is going to take months, and we are going to ask people to be patient. There are some people that are more important to get vaccinated than others, and we have to allow them to be at the front of the line. So as we're rolling this out, it's also going to be very important that we don't get too relaxed and just think, oh, we've got COVID solved. That we will need to keep our public health protocols in place. We're going to have to continue to wear masks and keep our distance from others. We're going to have to continue to stay home if we're unwell and get tested as appropriate. We're going to continue to need to keep a strong focus on hand washing and cleaning the common surfaces. And if we do see increased virus activity, there's no guarantee that we may not get, even if we come through the second wave, that we may not get a third wave potentially. And if we see increased virus activity, we may have to respond with restrictions the way we have in 2020. The COVID vaccine is following the same process as any other immunization in Canada, in that it needs to go through the rigorous process of assessment of the evidence on safety and effectiveness, and that's happening right now. None of the vaccine products have yet actually been licensed by Health Canada, because Health Canada is taking the necessary time to go through all these appropriate steps that any other vaccine would have to go through. I think it's important that people understand that we're following the same rigorous high safety standards for this vaccine as we are for any other vaccine or any other pharmacologic product. So while we're waiting for the Health Canada approval, we expect that to come very soon. And it's important that we want Nova Scotians to be reassured that once we get that approval, we are ready to start rolling out the vaccine as we start to get the weekly shipments of vaccine coming to us. This week, we'll be taking part in a dry run to test our processes when it comes to shipping, delivering, and tracking and storing the vaccine. This is going to be done in partnership across the country. All provinces and territories are doing this. We're going to be doing it along with the vaccine manufacturer, the federal government, our health system partners. But this is to test the system. There's no vaccine this week, but we want to make sure that all that mechanism of distributing a product that has to be kept at -70 works before we actually put vaccine into that system. And all of this is to make sure that when we actually get to the December 15th, that we're ready to go. And later this week, we'll also be involved in on a tabletop exercise that's focused on contingency planning around various things that could crop up around vaccine delivery. Again, all making sure that we're thinking about all the possible hiccups that could happen and being prepared for those. Getting the vaccine from the manufacturer to the provinces and then out to various community locations is a complicated and highly technical operation. And that's why we have a logistics team in place, including the important support from our Canadian Armed Forces, who have significant experience in this space. I've met with the team that's here to support us. They're highly experienced in this type of logistical planning, and I'm very appreciative and thankful for the willingness of our military colleagues and Nova Scotians to be part of the team to roll this vaccine out as quickly and as safely as possible. So the bottom line is for all Nova Scotians is that we are getting vaccine and we are prepared. This will be a months-long program, and people need to be patient. And we will need to continue with the public health protocols as we get through this months-long vaccine program. But it is good news. The vaccine gives us hope on the horizon. And I'm going to move on to testing now, back to where we are dealing with COVID today. Starting today, Nova Scotians outside Central Zone will have access to asymptomatic testing, or people who have no symptoms at all can get a test. We're focusing on those who have active social lives, a lot of close social interaction with many different groups. This is normal, but the more frequent and varied our social activities are, the more likely we are to have been exposed to COVID. And like I said on Friday, people are not going to get in trouble if they've been in a large gathering. Nobody's going to get fined. We're not going to ask you why you're there, but this is indicate who are the type of activities and who is most likely to be exposed, and therefore who is most important that we come forward to get tested. But nobody will be turned away. If you come down looking for a test, you will be able to get a test. So people living in the Halifax area, Central Zone, you can continue to go to the Zatzman Sportsplex in Dartmouth. This is for asymptomatic testing, and you don't need an appointment at that location. You can just walk in. Now, if you're in the Western, Northern, or Eastern health zones, you can go to the online self-assessment tool to book your appointment. If you feel that you're in one of the groups that we're recommending for asymptomatic testing, or you just feel you want to get tested, you can go make your appointment, and you'll get an appointment at a PAC that's close to you. We'll have spots open between now and Sunday, December 13th. We want to make sure that we can get through the lab all the tests and get people appointments booked before Christmas. So we'll be taking appointments between now and December 13th, and then getting people appointments and beyond that. Our pop-up testing sites are also moving around to different locations throughout this week and next week, and we're working with the operators and host communities on that, and there'll be local communication when we actually have the specifics on those from a day-to-day basis, where we're able to get the pop-up sites moving around. These pop-up sites are also for asymptomatic people, but because of the licensing of the rapid test, they are only for people age 16 and over. So whether you book online, drop into the Sportsplex, or visit a pop-up, it's important to know that because we're testing asymptomatic people, that you don't need to self-isolate while you're waiting for your test result, as long as you don't have symptoms. If you have symptoms, or if you've been identified as a close contact, or you've been at one of the sites where we do a public notification on, there's different ways for you to get through the self-assessment and book your appointment, and there's different requirements for you around self-isolating while you get your test result. I want to clarify an issue that's come up around the restrictions that we have in place in the Halifax area. There's been some confusion about offering online fitness classes. These can still happen. A business can go in and do what's necessary to, whether it's a spin cycling class or a yoga or some other kind of exercise, that there can then have people participating virtually. It's perfectly okay to do that as long as there's no more than 5 people in that fitness facility creating the online video or the online exercise opportunity. It was never our intent to stop these type of activities. The reason we closed down sport, recreation, and fitness was to limit the socialization and the gathering and the close contact of people that happens at these locations. It was necessary to do that while we had high levels of COVID activity. But we still recognize the importance of people being physically active for overall both physical and mental health and well-being. but you don't need a gym or a rink to get these benefits. You can take an online class, you can get outside and be active. So I would encourage people to walk, run, roll, or whatever it is you do to be active. These are all good options. But again, clarifying that even with the restrictions on closing fitness facilities down in Halifax, virtual classes can happen. So before I wrap up today, I just do want to talk a bit more about the upcoming holiday season. Unfortunately, COVID isn't going to take a break for the holidays, and neither can we. If you're going to host a gathering or going to a gathering this holiday season, you need to remember first and foremost that you got to follow the gathering limits in your area. And all that information is available on our coronavirus website. You should also understand about who you get together with, people's age, underlying health conditions, what type of work people do. Some people are at higher risk of potentially being exposed because of their work, and factor that all in. It's all about thinking about who might be put at increased risk because of the underlying factors, and who might be at increased risk of bringing a coronavirus with them when they come to a social event. It's important that even if you have something planned, if you're living or if you or someone you're living with becomes unwell, then you just can't participate in that event, and certainly don't bring people into your home if somebody in your home is unwell. And also being careful about, as we said, around Thanksgiving, around serving food. You need to think about serving food differently rather than not having a buffet style with multiple hands or going on serving utensils. It's important that all the food safety requirements are met when preparing the food, and then having a single person serving that out. So we have more information up on our on our coronavirus website around holiday preparations. I also want to remind people about that if they're planning to travel outside of Nova Scotia over the holidays, it's that first of all that we're asking people to only have essential travel outside of the province. But if you do have to travel, you need to make sure you understand the restrictions, first of all, in the area that you're going, and the ones that you will need to follow when you come back. And if you are hosting guests from outside of Atlantic Canada, you'll need to know that what is required of them and the members of their household. We have all the protocols for what's required of whether it's essential or non-essential travel, people coming into the province, what the protocols they have to follow if they're coming in over the holidays, and on our coronavirus website. So this year, the best approach for holidays is going to be staying close to home. We may still have restrictions on travel within the province. That is yet to be determined. But regardless of if we do or not, staying close to home, avoiding non-essential travel out of the province, and focusing on small gatherings, small numbers, making sure if you are getting together, try to do it as much as possible with consistent people over time. By tomorrow, we'll have specific guidance on the website that will speak to corporate holiday parties, food and toy drives, carolings, concerts, holiday markets and shopping, and more. So there'll be much more detailed information coming. But at the end of the day, I know lots of people have already done this. This is the year that we need to plan our holidays differently. But I'm confident that we will do that as we've always done. We need to find a way to make all our old traditions COVID safe, and maybe in that we can find some new traditions as well. As I've said before, so whatever reason we're celebrating over the holidays, whether it's a specific religious observance or some other tradition, this year's our focus needs to be primarily that on loving and caring for each other by keeping each other COVID safe. That should be our purpose for these holidays. And if we have fewer people around our tables this year, that means that everyone is going to be here next year to celebrate. And so I believe that's a price that we're all willing to pay. So before I hand it over to you, Premier, I just wanted to mention that this tie that I got today, I got it from your nephews, Landon and Jackson. So I wanted to let you know that, and I appreciate them sending me the tie. And I also wanted to give it a shout out. I actually gave a blood donation yesterday, and they asked me, could I send a message that we're always short of blood. Blood donations are important and essential, that they always run short over Christmas. And so really I would encourage anybody who can give a blood, but they do a good job. It's safe. We need you to go give blood. So if you can do that between now and over the holidays, please do that. Premier.
I'm sure it'd be pretty intimidating. The public health officer coming in as they're taking your blood and you following all, making sure they're doing everything right. And I just want to say to Landon and Jackson, that tie looks great, and I'm really proud of both of you. And even though I'm not going to get a chance to see you over this holiday, it is a small price to pay when we're going to get an opportunity to really kick up our heels next summer when you get a chance to come down to home and we play around on some of the toys that are in the garage. But thank you for thinking of Dr. Strang. It's very much appreciated. Over to you, Chrissy.
Thank you. We'll do one question and one follow-up in the amount of time that we have for today. First question will go to Canadian Press, Keith Doucette.
Good afternoon. Dr. Strang, I'm wondering, given the trend downward in cases since this most recent outbreak, how concerning is the outbreak or the situation at the poultry plant that you mentioned? How worrying is that?
So we always, something like that has a potential to turn into, you have a large number of people, and we know if you look at other parts of the country, there's been large outbreaks in these type of facilities. That's exactly why we're acting very quickly. We learned about these cases last night. There was I was involved in a number of calls with the plant and my public health team yesterday evening to get things in place. And that's why we're acting quickly. It takes them 24 hours to kind of shut their plant down for lots of reasons, animal welfare being one of those. But we're closing the plant down temporarily, moving in quickly with testing of workers to make sure that as we reopen the plant, that it can be done safely, and we're not going to minimize the chance of any further cases within that facility.
I think it's important to give a shout out to those that are doing our testing. This is, even though we were hoping we wouldn't have one of these, with the flexibility around the pop-up shelter that'll take place, working with the town in that community, but also our mobile vans. This is the very reason we're doing this, so we can go in and wrap our arms around whether it was a particular school or, quite frankly, this workplace.
Go ahead with your follow-up, Keith.
All right, it's on a different subject, and it's for a colleague. I know you've talked about university students in particular, but is there anything new as we approach this longer break period, and any new advice you can give to students who may be traveling to areas where there's much higher levels of COVID, and obviously plan to return to Nova Scotia? We're pretty sure we know what they need to do, but I'm just wondering, has anything changed on that front in terms of what you need to tell these people?
Nothing new, but we recognize the importance of them, that for their own mental health and for their family traveling home for the holidays. If there's a different way that they're able to manage that and it works for them and not traveling, well, that would be great. Maybe there's family here within Nova Scotia. But if not, hopefully they're sensible that they're following all the COVID protocols, and there's a lot more COVID in other parts of the country, and people have to be very careful about. It's all the same rules about minimizing social activity, keeping distance, wearing masks, etc. But it will be a requirement if students have traveled outside of the Atlantic provinces when they come back for one of our post-secondary institutions. There will be a 14-day quarantine period when they return.
Next question will go to CTV's Natasha Pace.
Thank you. Dr. Strang, why is Nova Scotia only getting 1,950 doses of the vaccine as opposed to more, considering our population and the number of active cases?
So in the first run, and then the first trial on December 15th, every province is getting that amount. It's simply one. This is really more about testing the delivery mechanism. We don't want to put large amounts of vaccine into a system that hasn't been tested yet. We want to make sure that if there is a problem, that we're minimizing the wastage that would happen. Once we get through December 15th, as I said, we're going to again start getting weekly allotments of vaccine. What we're expecting to get is 150,000 doses by the time we get to the end of March in 2021. That's enough for 75,000 people. That is our per capita allotment of vaccine.
Go ahead with your follow-up, Natasha.
Thank you. For either the Premier or Dr. Strang, Shannon Park Elementary School, I believe, is the 10th school in Nova Scotia to temporarily close because of COVID in the last 2 weeks. Are you considering at all extending the winter break in light of the second wave?
Listen, first of all, I want to say thank you to all of those students across our province and parents who continue to ensure that they are following public health protocols inside of our school buildings. You're right, this is, I think, the 10th case. To this point, none of that has been transferred within schools. We're very grateful for that. But we'll continue to make sure that the public health protocols are followed within inside of our institutions, and we'll just assess all of that, the question about the break and that as we continue working with public health and, of course, our partners in education.
Next question will go to CBC Jean Laroche.
Good afternoon, Dr. Strang. Correct me if I'm wrong, but I thought the federal advisory body for vaccinations recommended that people in long-term care and workers in those facilities go to the front of the line. So we are not strictly following that advice, and I'd like to know why.
So the first groups that are in that prioritization include long-term care staff and residents, healthcare workers directly involved in COVID response, seniors, beginning people 80 and plus, and for some provinces, rural and remote communities. We don't have those in Nova Scotia. So they haven't said within that which one should come first. We are starting with our acute care healthcare workers simply because the logistics around the first allotments of vaccine, they have to be delivered in a way that's very close to the ultra low temperature freezers, and so it'll then be easy to have a clinic as part at a location on the QE2 kind of complex, our tertiary care medical teaching hospital, and the workers are very close by. As we get into January and we get other vaccine products, but also we expect that the restrictions on transportation for the Pfizer product become a little less, then we'll be able to start moving into immunizing long-term care residents and staff. We are looking at, certainly in our first amounts of vaccine, if we have the capacity, that we have long-term care regional care units, and we will be looking to have those staff transported to the immunization clinic so they can be included as part of the initial vaccination.
I know we haven't had many times for too many questions on the line. Dr. Strang and I will be available again on Friday. I have a few things that's taking me away from here, but I do want to just emphasize and close with the issue that even though the vaccine is on its way, COVID is still here. We need to be vigilant when it comes to ensuring that we're following the public health protocols. There's nothing more that COVID itself likes is when we stop following those protocols. When we get too close to someone, we stop wearing a mask, or quite frankly, we just decide this is a day that we're going to ignore those protocols. That's when COVID finds its way into communities. And while most of COVID right now is in Central Zone, it's showing up in other communities across the province, and we need to continue to make sure that we keep it as where it is a few cases, try to get back to where we've eliminated it in many of our communities. So stay committed to the protocols, stay strong, and stay safe, everyone.